Hello there. Thank you for staying here on the AM show. It's now time to get into our big stories, and we start off on news that broke yesterday on the back of a rather unfortunate incident. The Pharmacy Council has shut its shop for administering wrong drugs, leading to the death of a 5-year-old boy in Kenyasi in the Ashanti region. Now, there's a bigger picture to look at. This is just one incident, right? But it tells you a story of what is likely happening around the country. What is the qualification, or what must be the qualification of someone who administers or dispenses a drug to you at the pharmacy shop? What should the ideal practice be? And my colleague in Kumasi, who's been following this story, Kenyasi-Adwumam, is joining us to just give us a bit of a background, especially for those of you who are not familiar with the story. Great to have you here, Kenyasi. So just quickly run us through what exactly happened leading to the decision by the Pharmacy Council to shut down this particular shop.
All right, so this boy we are talking about is a 5-year-old boy who lives in Kenyasi-Adwumam in the Ashanti region, in the Public municipality. And unfortunately, he was taken by a rabid dog, and he was trying to seek help or get medicine from the life dream pharmacy in the Kenyasi-Adwumam, also in the Public municipality, where unfortunately the pharmacist there gave him a wrong medicine for treatment. And unfortunately, this 5-year-old boy had to pass out. The Pharmacy Council decided to then shut down the shop, which is the Life Dream Pharmacy, because of the decision they took. We are told by the Ashanti Regional Head of the Pharmaceutical Council, Dr. Benjamin Kwabena Echampo. He says the decision to shut down the pharmacy shop comes because the Ashanti Regional Health Directorate brought a report, a compiled report on the incident, and they came with that decision. So they had to shut down the pharmacy shop because there was a decision taken away from the Ashanti Regional Health Directorate, considering the fact that the issue was a critical one, and that decision had to be made.
Right, and we are sure that the person who administered the drug is actually a pharmacist or a shop attendant. Which is which?
Oh, so she is actually a pharmacist, not a shop attendant. She is a pharmacist, that's according to the head of the Pharmacy Council in the Ashanti region. She is a pharmacist, and right now they are still treating her. Unfortunately, they do not know her whereabouts. The family is also seeking justice at the time.
Right, grateful for the background there. That's my colleague Kenyasi-Adwumam, who's joined us from the Ashanti region, just to help you understand what exactly happened and how the story has developed. This actually happened sometime last year, but the Pharmacy Council has taken a decision, a very critical one, which sparks a lot of conversation. This morning I've been joined by Dr. Emmanuel Kweku Ireland. He is National Chairman of the Community Practice Pharmacists Association, and also Dr. Kenyasi-Adwumam, who is a pharmacist and a fellow with the CDD. I'm so pleased to have the two of you here. Thank you so much for joining me this morning. So we just heard my colleague from the Ashanti region give us a brief of what exactly led to this. Let me start with you, Dr. Ireland. Did this story come to your attention when it initially occurred? And what do you know to be the processes that were involved getting us to this point?
Thank you very much for the opportunity. Good morning to you and your viewers around the world. Yes, in fact, I also first read the story in the news. However, what I know is that the Pharmacy Council, which is the regulator, has swiftly moved in to trigger the necessary action.
Right. So for you with the community practice pharmacists, and I've seen a lot of reactions on social media, Dr. Kenyasi-Adwumam has also had something to say about it, and we'll be hearing from him shortly. But many people have been talking about their experiences at different pharmacies. And in fact, some even suggest that when they visit the pharmacy shops, it is not an actual pharmacist that sees them. It appears to be an attendant or somebody who is administering the drug to them. What should the ideal thing be? When you visit a pharmacy, what should happen between you as a client and the person attending to you? Dr.
Thank you.
Island, yeah.
Yeah, thank you very much. The Pharmacy Council issues two types of licenses. They issue wholesale and retail licenses. Every pharmacy, every community pharmacy you see is a retail pharmacy. Again, the Pharmacy Council, which is the regulator, also registers 5 kinds of pharmacies. We have the retail pharmacies, wholesale pharmacies, retail and wholesale pharmacies, pharmacies within hospitals, clinics, and other facilities that require a pharmacy. And then manufacturing wholesale pharmacies as well. So these are the 5 kinds of pharmacies the Pharmacy Council registers. Now, every pharmacy is permitted to supply medicines, certain classes of medicine. For instance, a pharmacy is supposed to supply class A medicine, which is prescription-only medicines. Also class B medicines, which is pharmacist's list of medicines. That is medicines that may be dispensed by a pharmacist without a prescription. And then class C medicine, which is over-the-counter medicines. Now, when it comes to supervision in the pharmacy, it's only a superintendent pharmacist or a pharmacist who has been registered by the Pharmacy Council and is in good standing that is supposed to supervise the supply and provision of pharmaceutical service from a registered pharmacy. It's only the pharmacist that is required by law to supervise.
So when you say supervise, Doc, do I get the impression then that they can employ people as shop attendants and under their supervision, these shop attendants can administer drugs? Because you keep using the word supervision. And so I'm wondering if my understanding of it, as I have explained, is what should be the practice.
Yes. So from the word superintendent, the pharmacist superintendent, he is solely responsible for every action, every activity that happens in the pharmacy.
Okay, let me cite an example for you. Sorry, Doc. Let me cite an example for you so that I understand we're on the same page. So you are a pharmacist. You set up a pharmacy shop. You employ me, who has zero to no knowledge in pharmacy. And people come in with prescriptions. I'm able to identify the drug and dispense it. Even if you're not there, but you supervise me, say, probably virtually or whatever mechanism we choose as a shop to use, are you saying that is allowed?
Yes, I was coming to that. We work with other cadres of staff. Now, we work with a pharmacy technician. We also work with medicine counter assistant that we call MCAs.
Okay.
Now, the technician has been trained. They have HND in pharmacy technician course or pharmacy dispensing. Okay, and then the MCAs have 6 months of training as MCAs, and they are the auxiliary staffs that we work with. Now, I dare say that no pharmacy worth its source is supposed to employ any other cadre of worker aside these 3 that I've mentioned: the pharmacist, the pharmacy technician, and the MCA. Okay, so these are the people the pharmacists work with, and they have the requisite training to be able to help the pharmacist deliver his or her job.
Right. Let me go to Dr. Sapon-Esido. I'll come back to you. Doc, thank you for holding on. So we've heard Dr. Island tell us what the practice should be. You are concerned about what is happening in the country. I'm just wondering, as a client, walking into a pharmacy shop and wondering, is this person qualified or not? There have been occasions when I have had reason to question the competence of some of these attendants. I'll share a story later, but let me ask you your initial thoughts about this incident and your comments on what Doc has shared so far about what the ideal practice is prescribed by the law.
It's interesting. Yes, I am concerned, and I'm concerned from at all fronts. Because to start with, I am a pharmacist, and I am a practitioner. Dr. Island is a colleague. In fact, we know each other. And one thing that holds true for the profession of pharmacy is that our motto says we are the friends of the human race. And therefore, I get concerned when remotely it is suggested that through the actions or otherwise of a professional colleague, something like this has happened. I'm further concerned because I listened to JoyNews yesterday when the story first broke. And I heard the regional manager of the Pharmacy Council say that when the said incident happened, the pharmacist was not on the premise. I've just heard your colleague in Kumasi say that the act occurred in the presence of the pharmacist or was undertaken by the pharmacist. I think that, confusion needs to be addressed because they bring into perspective different scenarios. If the first scenario, which I heard yesterday on JoyNews, is anything to go by, and the pharmacist wasn't on the premise, then there is an issue around supervision, like Dr. Island said. Secondly, if the pharmacist wasn't on the premise, we need to check the qualifications of whichever attendant was involved in the incident, whether it was a technician, whether it was an MCA, or whether it was an unqualified person, which I doubt it would be a totally unqualified person. But we need to check that as well, because that is important, because that borders on the professional conduct of the pharmacist and the pharmacy in question, because there are regulations for professional conduct of a pharmacy and a pharmacist. Now, all that being said, I'm further concerned from a parent point of view. And I am concerned because when you go to the pharmacy, I always tell anyone who cares to listen that the first thing you have to do is ask for the pharmacist.
Right.
So if this confusion exists, the question I ask is, did the parents know they needed to ask for the pharmacist? Then we move on to the medication that was used. The information we have so far, and I'm going by the information in the public domain, is that the child had been bitten by a dog. And therefore, the first thing to do is to check the vaccination or otherwise of the said dog to see if they've had their rabies vaccine. And if they've not had it, then for them to have a rabies vaccine. The question then becomes, why was a tetanus jab given instead of a rabies vaccine? Was it that those in the pharmacy didn't know? If they did, what went into their professional and clinical decision making? That is another thing. And then for the parent, why were they taking an injection in a pharmacy shop? Because was the pharmacy licensed to administer an injection? So there are so many things as a practitioner I am asking myself. And I come to the single conclusion that perhaps if the parent had asked to see the pharmacist and had realized that the pharmacist wasn't on the premise based on what I heard the regional manager say, all these sequence of events could have been aborted. And that brings me to the level of patient education that citizens of the country have when they are accessing healthcare in a pharmacy. So these are the things that make me concerned.
All right. And Doc, I'm just happy you spoke about patient education because I'm going to share a personal story. About 2 weeks ago, on my way back home, I felt terribly sick. And I decided to walk into a pharmacy and test for malaria. So I'm sitting there, the lady comes to me, goes through the process, takes out the wipe, gives me a prick, takes out I'm not sure what the name is, but she takes the blood and then puts it on the disc, right? And then puts the solution on it. So I'm watching as the thing is reading, going up, and then her response is, "You're negative." And I said, "No, I'm not. Your disc didn't record anything. This is a failed reading." And she looked at me, and I'm sure she was wondering how I got to know. So because I was having that interaction with her, it appears to me it was a senior colleague who turned and looked at her and said, "Run the test again." And then it was failed again because, there's the C, there's the T, and then if you have one line somewhere, I can't remember exactly where, but it meant that you were positive. If you didn't have any line at all, it meant that it was a failed reading. So I'm thinking to myself, if I didn't insist or if I didn't know, I would have walked out of this place thinking that I was malaria negative. And who knows what the impact could have been there. So it's a very important point you raise. But then again, I'd like for you to tell me, Dr. Ireland, what kind of training is offered to such people who come. You spoke about a 6 months training for people who are, medical attendants. But beyond the certification or whatever process it is that they go through, what are the do's and don'ts for them? So if somebody walks into a pharmacy and, like Dr. Kenyasi-Adwumam says, doesn't know that they have to ask for a pharmacist, what should that person who is not a pharmacist know to be their limits and when to invite in the actual pharmacist?
Thank you very much. Just this past Tuesday, the CPPA, I'm talking about the Community Practice Pharmacists Association, launched a campaign called I Am Your Pharmacist campaign. We invited JoyNews, but unfortunately, the reporter didn't turn up. And what we are telling the public is that when you enter a pharmacy, just like my colleague, Dr. Kenyasi-Adwumam said, ask of the pharmacist, because the pharmacist is there for you. Whatever money you pay in the pharmacy, you are paying because you have received some pharmaceutical service from the pharmacist. Now, the other cadre of staff that we work with, they are there to support the pharmacist or work under the supervision of the pharmacist. I expected that this malaria test that you talked about, for instance, after the MCA or the technician, whoever the person was, after the person has conducted that, the person should have presented it to the pharmacist for the pharmacist to make a clinical pharmaceutical judgment and then take it from there. Okay? We don't expect any other cadre of staff, to move on with this, because even I expected your interaction with that staff to be with the pharmacist. Okay? Now, when you're performing a test like that, the test would either be invalid or valid.
Yeah.
And we have, steps we follow when the test is invalid. All right? And then to engage you further. And where we have to refer you, we refer. Okay? So every staff must know their limit. And of course, we have our limits. And even pharmacists, after having engaged you and we realize that this issue is beyond, our scope, we refer you to the nearby facility. Okay. So we are encouraging the public. What's happening in Kumasi is highly condemnable, like my colleague said. We don't know whether it was because the report I read didn't mention a pharmacist's name.
Right.
Did not mention a pharmacist's name. I know it's an investigation. So if, as of today, it happens to be a pharmacist, I don't know yet. But what I have read so far is not a pharmacist. The pharmacist wasn't in the premises. Now, that is not to justify anything. The law requires that so long as the pharmacy is open to the public, there must be a pharmacist present.
At all times?
Okay.
At all
At all
times?
times. Once the pharmacy is open, there must be a pharmacist. So it is surprising, okay, to note that, pharmaceutical services are going on in the absence of the pharmacist. So I want to say that, with the family that has lost this child, it is very disheartening. Our condolences to them. And I believe, I'm so happy that the Pharmacy Council has swiftly moved in. And it's just unfortunate that this happened. Yeah. But then it also tells us that the Pharmacy Council must also up their game with supervision. Right. Because whatever is happening there, in fact, I was really shocked, okay, to see a whole lot of things going on over there. But then I asked the Pharmacy Council to up their game, with strict supervision and know exactly what goes on in all these pharmacies and then over-the-counter medicine shops. But then again, let me say that you keep referring to pharmacy as a shop. Pharmacy is not a shop. A pharmacy is a pharmacy.
All right.
It's not a pharmacy.
The pharmacy is the pharmacy. Thanks for the education. Dr. Sapoe-Asiedu, let me come to you again. There's so many stories to share when it comes to client, whether it's a medical attendant or it's a pharmacy, the relationship between these two, the client and the pharmacist. So many examples to share. I have seen people go with prescriptions and the pharmacist or the attendant saying, we don't have that here. However, I could give you another option. Is that allowed? And what are the guidelines for that? Since we have all agreed that public education probably is the key to avoiding some of these things, let's just take the opportunity to educate the public and those who are watching us now. What should I do if I walk into a pharmacy and I'm told that the drug that has been prescribed is not available, but the person wants to give me other options?
Thank you. In all situations, like Dr. Island said, the pharmacist is the expert in drugs. And so the scenario you present can present itself in so many ways. And I'll give examples. So let's say you came to a pharmacy. You've been prescribed amoxicillin, 500 milligram capsules, one to be taken 3 times a day for 7 days. The pharmacist sees you walk in and you are coughing badly. The 500 milligram capsule is not available, but has 250 milligram, for which you can take 2 capsules 3 times a day and get the same bioavailability and clinical outcome.
Right.
The pharmacist can, in their professional judgment, suggest to you that this might be a route to take. That is one scenario. The second scenario may be you are, say, a hypertensive. You've been prescribed Novas or Istin, which is amlodipine. The pharmacist knows that there are 2 types of amlodipine. There's the mesylate and there's the bisphosphonate, and knows what Novas contains, and can vouch because of the way they police their supply chain that they've got a substitute generic that has the same clinical outcome as the Novas you are purchasing. They can also suggest to you that in that situation, you could take this other alternative. And those are all legal clinical judgment decisions. What would be illegal is if the prescription said amoxicillin and the pharmacist or the attendant, because I doubt if a pharmacist did that, I'd be really surprised. Said, well, I don't have amoxicillin in stock, but you could take, say, clarithromycin or flucloxacin. That would be moving the category entirely, and that would be illegal. So, again, that is why the buck stops with asking to see the pharmacist, because these decisions must be made by a pharmacist. And in a country where our supply chains can be very precarious, where sometimes there can be shortages of medicines from time to time. It's only the pharmacist who knows what's going on in the supply chain and who can make these decisions appropriately. So we need to understand, and that's why I'm saying that this would only solve itself by public education.
Right.
I hear Dr. Island say the Pharmacy Council up its game, and I agree. But globally, where pharmacy or any profession has become professionally robust, it's been because of the empowerment of the users of the service, which is the patient under these circumstances. And I believe that we should work more down that route than work down the route of the regulator, because the regulator is spread thin anyway, and they do not have enough hands to just supervise rigorously as we would want them to do.
So there are a few people who are concerned about some issues on social media. They're getting interactive with us. I would just like to read their comments and then take your quick responses. And I'll start with you, Dr. Kenyasi-Adwumam. This is from Osman Idris, who says, it's a developing canker. The pharmacy should be separated from the medical laboratory. And Musa Mubarak actually replies to his comment and says, it's a very dangerous canker that's emerging and authorities are not bothered about it. And I know examples of that where you see a lab on the side and a pharmacy on the other hand. So it's almost like, go here, see what's happening, come and get the medication. Do you agree with the concerns being shared here, or this is not an issue to worry about?
You see, pharmacy is evolving. I work in the UK often, and I work in Ghana as well, where there are a lot of spot tests that are undertaken in the pharmacy. For example, in many pharmacies in the UK, you can test for your cholesterol, you can test for your sugar levels, you can test for your HbA1c. In Ghana, I know you can test for malaria. There are so many tests that are done in the pharmacy currently because the pharmacy has been seen as the medical stop on the high street and a place where there's easy access. So if you want to improve access to healthcare globally, it is identified that the pharmacy is the place to go. So for example, if you come to the UK, you'd realize that a lot of vaccinations are done in the pharmacy. A lot of blood pressure screening is done in the pharmacy because that is the first place where you will identify the unidentified people who are walking with chronic diseases and can't be bothered to go into the hospitals because they would not give them symptoms per se. So for example, if someone came to test their blood sugar, pharmacists can do a sugar test and quickly know that this person could be borderline diabetic or something and refer them outwards. So those are good things. What should not be happening is for a laboratory to be next to a pharmacy where you go and do your test and then the interpretation is done as though you have had a diagnosis. That caveat must also be put into perspective because now there are people who have PharmDs, who are clinical pharmacists, who also have an extent of understanding of some of these things.
All right, so they can make diagnosis?
Even some of them can prescribe. In the UK, for example, they are prescribing pharmacists.
Okay.
Yes, and in the United States and other things, they are prescribing pharmacists. And so that's why I'm saying that we need to educate the public. Healthcare is evolving so quickly that before you blink, the goalpost has moved. And a lot of the time, we are not catching up with the changes, and the citizens are not also being educated about the changes that are taking place. Right. So I can understand Osman's concern if the lab is next door to a pharmacy without, say, someone with a PharmD who has an understanding of these things or is taking it straight to a pharmacist or a technician or something just to interpret it, that would be a breach of the law and shouldn't be encouraged. But that should be distinguished from going to a pharmacy that has a rapid test kit that can check your sugar, can check your cholesterol, and think it's illegal. That is not.
All right.
We need to clarify.
All right. Dr. Island, you're a PharmD, right? So how do I know someone is a PharmD? Do you have anything that identifies you as one so that if I'm walking into a pharmacy with a lab test result, I know that I'm getting the right interpretation to what the test result is saying. Is there any way to clearly identify who a PharmD is or who is who in a pharmacy? Hello, Dr. Island. Hello, Doc?
Yes, yes. Can you hear me now?
Yes, I can.
Thank you. Yes. A simple way is to identify yourself and ask of the person's name. Okay. So, like Dr. Esiedu said, we have that knowledge to be able to, give off that clinical pharmaceutical service. However, let me go back to what you said earlier. What the person was trying to know. There is a pharmacy and there is
laboratory.
A laboratory lab. Now, let's put this in the right perspective. We have health facilities regulatory agency, that is HEFRA, that inspects and licenses these facilities to operate.
Okay.
All these facilities are being regulated. They all have regulators. The lab is being regulated by HEFRA, even though pharmacy is also being regulated by HEFRA. But then there is that collaboration, MOU between HEFRA and then Pharmacy Council, for Pharmacy Council to solely do the supervision which they recognize. So we expect that irrespective of these two facilities, every study that is carried out over there must be done under the supervision of the right personality. For instance, in the lab, there must be a lab scientist there. In the pharmacy, there has to be a pharmacist.
Doc, so my question is, for me walking into that place, how do I identify if there is the right person there? So do you have anything that says or suggests? So you talk about HEFRA, for example. If I walk into a clinic, I see there's a framed certificate, right? That shows that this place has been approved to work by HEFRA. Is there any way I can identify whoever is attending to me at the pharmacy to say, okay, this person meets the right qualification? Is there any form of identification?
Yes, and there is a requirement that once the pharmacist is on duty, it has to be his name displayed in the pharmacy as Mr. A or B on duty. 2, the pharmacist must be in the prescribed attire. We have a white coat with the Pharmaceutical Society pressed on it. You'd also see the name of the pharmacist on it.
Right.
Okay. Yes. So that is the first thing to identify a pharmacist with. That is why we are asking that when you enter the pharmacy, please ask of the pharmacist. In fact, you don't necessarily even have to ask of the pharmacist, but that is the campaign we are embarking on. That I am your pharmacist. The pharmacist must walk up to you.
Okay.
The pharmacist must welcome you and interact with you. Okay. That is what we expect from all pharmacists. You don't need to sit in your corner and expecting that somebody will come to you. So that you move into your office when there is the need to take the client into your office for an interaction.
Right.
That is what we expect from the pharmacist.
Right.
And we are asking the public, please, anytime you enter the pharmacy, ask of the pharmacist. But please, let me add this bit of it. Dr. Siedu said that pharmacy has evolved. It is true. In Ghana here, last year, we launched what we call a fee for professional service. In other words, the pharmacist is now providing services, okay, that he or she has been trained for. There are specialized services that will be provided by the pharmacist, which are not, part of the core daily services that will be providing. Okay. For instance, medication use review, medication therapy review, looking at a whole gamut of medication that the patient is taking and then coming out with the best way in order to give best outcomes as a result of the medication. We have compounding services. We have medication reconciliation service, and then smoke cessation service, for instance, weight management services, nutrition counseling for diabetic patients, family planning services, and all that. These are services that, you need a pharmacist with the requisite knowledge to provide for you.
Right.
Okay. So the scope of pharmacy practice has evolved beyond just dispensing.
All right. We quickly need to wrap up, but I've just got about three important things to find out from the two of you. So if you can be as snappy as possible. And let me start with you, Dr. Ireland. What's the difference between a pharmacy and a chemical shop? And what should I know when I'm entering any of these? The differences.
A pharmacy is a registered premises where you can get your Class A, Class B, and Class C medications, as I mentioned earlier.
Right.
Now, the over-the-counter medicine shop is a place where you can only get your OTC medicines, over-the-counter medications. But in the pharmacy, you can get all medications.
So it means that if I have a prescription, I shouldn't walk into a chemical shop, right?
It depends on what is on the prescription. If it is over the medicine,
over the counter,
it's an over-the-counter medication, you can get it from an OTC shop. But then, if it's a prescription drug, like my colleague Dr. said, if it's something like amoxicillin and the rest, you walk into a pharmacy for it.
Okay. So if I got you clearly on the bit of the practice of a PharmD, which you are, I can just walk into your outfit and say I'm unwell, and you can ask me questions and prescribe medication without me seeing a doctor, right?
The pharmacy in most communities is the first point of call.
Right.
The pharmacist has a requisite knowledge. The law mandates him to treat ailments or diseases of common occurrence. So, provided that it fits into this, the pharmacist is required by law to do that. Where is beyond the scope of the pharmacist refers you to the nearest clinic or hospital.
And on my last bit for you, since you were the Community Practice Pharmacists Association, is it the case that you have, say, for example, one pharmacist who's opened about 3 shops and so is unable to be there at all times? What is creating that gap or that missing link where we go to pharmacies and we don't see pharmacists present?
This is where I'll give a plus to the regulator, the Pharmacy Council. The Pharmacy Council ensures that every pharmacy is registered by one pharmacist.
Okay.
And it is the case that a pharmacy must be superintended by one pharmacist. Now, a case where you see the same company having a chain of pharmacies, it is required by law that once the pharmacy is open, in many cases, there is somebody responsible there's a superintendent pharmacist responsible for that pharmacy. It's not the case that one pharmacist will superintend 2 or 3 pharmacies. It's not the case.
All right.
That is not the requirement of the law. The requirement is that one pharmacist, one pharmacy. So I'll give you a scenario. If I have a chain of pharmacies, my license, is only for covers only one pharmacy. The other 2 or 3 that I have must have every pharmacy must be registered by another pharmacist.
Right.
So it means that if I have a chain of 3 or 4 pharmacies, it means that I have 4 pharmacists responsible for these 4 pharmacies.
Right.
And then when needed, I add on because, one pharmacist cannot be there for all this. In case I'm running 24 hours, for instance. Okay, the pharmacist may start work from, say, 8 o'clock to 5 p.m.
Right.
Another pharmacist, who is a local pharmacist, will have to continue.
Thank you very much, Doc. And let me wrap up with you, Dr. Kenyasi-Adwumam. Since you're very keen on public education being the way or the solution, just in wrapping up, what would be the key things that you want everyone watching to know in terms of what a pharmacy offers and what they must be looking out for?
Well, basically, I'd say three things. I disagree slightly with what Dr. Ireland said regarding a prescription, because a prescription is a legal document.
Right.
So if you have a prescription, though the medication on that prescription could be over the counter, the minute it goes on a legal document, you should take it to a pharmacy. That has been my standing position and interpretation of the law. I can understand the practicalities of where Dr. Ireland is coming from, but for as long as it's a legal document, it's a prescription, then it has to go to the pharmacy. So that is something that the general public must know. And if we stick with this, it would also decrease the nefarious activity that sometimes can go on in other sectors of the medicine supply chain. The second thing is always ask for your pharmacist. And the third thing is, if the pharmacist is not available, you are better off not using the service. Those are three things that would sanitize the system. If the pharmacist is not available, you are better off not using the service. And you, at the outset, when I started, this is why I'm saying, if the parents, condolences to them, had asked for the pharmacist and they were not available, all this could have been avoided. And that is the biggest learning we need to take away from this unfortunate situation.
I appreciate your time here, Dr. Kwame Sapong-Isiri is a pharmacist and a CDD fellow. Earlier, you heard from D. Emmanuel Kweku Ireland. He's the national chairman of the Community Practice Pharmacists Association. So what it is that as a client or a patient, you must be armed with knowledge. You must know what you're going in for, and always remember to ask for your pharmacist. This morning's conversation has rather been on the back of a very sad incident where a 5-year-old lost his life after being bitten by a rabid dog and being administered a tetanus injection instead at a pharmacy. That pharmacy at Kenyasi in the Ashanti region has now been closed down. It's important that you stay alive. Well, up next, we are having a conversation about the LGBTQ+ bill. All you need to know right here on the AM show.